Sometimes during a physical exam, we notice that there is a pulsation or throbbing in the patient's neck. How do we approach this? How can we differentiate whether the pulsation in the neck is arterial or venous? By arterial, we mean a carotid pulse, and by venous, we mean a pulse from the internal jugular vein. There are 4 characteristics by which we can distinguish between these two. First, the venous pulse has 2 peaks, whereas the arterial pulse has a single peak. Second, the arterial pulse is palpable, but the venous pulse is not palpable, except in patients who have severe tricuspid regurgitation. Third, if you press at the base, meaning the lower neck and above the clavicle, and the pulsation is venous, it will stop and disappear. But if it is arterial, it will persist. And finally, the 4th step is inspiration. We ask the patient to breathe. Please take a breath. When you breathe in, a negative pressure is created in the chest, which causes the venous column in the neck to be completely emptied into the right atrium. Therefore, if the pulsation disappears with breathing, it indicates that its origin is venous and from the internal jugular vein. But if it still remains, it indicates an arterial origin and is due to the pulsation of the carotid artery.